Hi, future doctors. Hello, everyone. Am I visible to everyone? Is my voice clear? Okay. So, um, today we are going to cover a relatively difficult topic. Yeah, this is what I said about last topic as well, but this is even more complex. So, as we go about, the complexity of the topics is going to increase. All right. Um, we have studied about the synthesis of fatty acids in the last chapter, the biosynthesis of fatty acids. Today, we will be reading about the synthesis of complex lipids. Okay, we studied this about the synthesis of how the saturated palmitic acid is formed. Okay, using the precursor of acetyl CoA, the substrate acetyl CoA. Now we are going to read about long chain fatty acids, that is eicosanoids. Okay, these are fatty acids containing 20 carbons or more, right? And eicosanoids are what do they produce? They produce prostaglandins, prostacyclins, thromboxane, lipoxins, and leukotrienes. If you remember, we discussed this in the chapter of introduction of lipids. Okay, acyl glycerols. If you know about triacyl glycerols, I have been talking about triacyl glycerols quite a lot. Triacyl glycerols are the major storage form of fat, okay, inside the body. So acyl glycerols. Acyl glycerol, as the name suggests, this is something related to glycerol and fatty acid. Fatty acid is what is named as acyl, right? So glycerol and fatty acid. So we have studied about the synthesis of fatty acids. Now, how fatty acids combine with this alcohol, glycerol, or other compounds like sphingosine, that we are going to read in this subsequent session. Okay, I hope this is clear to you. Okay, so because what we are going to read, what is the application, what is the biomedical importance of it, that everyone should know. Why we are reading it? What is this acyl glycerol that I'm talking about? So everyone should be clear about it. Okay, understood? Now, to begin with, we'll first talk about eicosanoids. Eicosanoids are formed from a carbon 20 or a 20 carbon chain polyunsaturated fatty acid. Okay. Now, they are prostaglandins, thromboxanes, leukotrienes, and lipoxins. Okay. What is their major function? They act as local hormones. Now, usually enzymes act locally. Okay, enzymes are released via ducted glands carrying having a duct, and they act locally. And hormones, they will be produced by ductless glands, and they will be acting even at very far locations from their area of production. So hormones can act at far off places, like the thyroid hormone. Say the thyroid hormone is produced in the thyroid gland, but it has effect on the intestines. It has effect on the bones as well. So hormones have effect at multiple places. Thyroid hormone has effect on the heart as well. Okay, so hormones have effect at multiple places, even far off places. They need not act locally as compared to enzymes, the digestive enzymes or whatever enzymes that we have in the body. But these prostacyclins, prostaglandins, thromboxanes, leukotrienes, lipoxins, what are they? They are a special type of hormones or signaling molecules. Okay, and they act locally at their wherever they are produced. Therefore, it means that they will be produced at more than one place. They will be produced by more than one type of tissue, and more than one type of different tissues will be producing different types of prostaglandins, different types of thromboxanes. Got it? Understood? Now, They act as local hormones functioning through G protein coupled receptors. G protein coupled receptors, very, very important to produce biological effects. And there are three groups of eicosanoids that are formed. First is formed from linoleate or linoleic acid. This is a nutritionally essential amino acid. So it is only got from the diet. Next, from alpha linolenate or alpha linoleic acid. Linolenic acid, again, this is nutritionally essential. So it is essentially required in the diet. It cannot be formed inside the body. Third is arachidonate. Arachidonate can be formed inside the body also, and it can be obtained from the diet as well. Okay, so it is not nutritionally essential compared to linolate or alpha linolenate. So there are three groups of eicosanoids. One that is coming from linoleate, second that is coming from alpha linolenate, and third that is coming from arachidonate. Three groups, group 1, group 2, group 3. Got it? Understood? Arachidonate, as I told you, it may be obtained from the diet or it may be formed from position 2 of phospholipids in the plasma membrane by the action of phospholipase A2. So there are a lot of phospholipase enzymes, A2 and the like, okay, A1, A2 and all. So phospholipase A2 acts on the position 2 of, or the carbon 2 of phospholipids. Okay, position 2 of phospholipids, and it breaks it down to form arachidonate, okay, or arachidonic acid. Understood? Now, there are two pathways. One is the cyclooxygenase pathway. This cyclooxygenase pathway produces prostaglandins and prostacyclins. Okay. The other is the lipoxygenase pathway, which produces leukotrienes and lipoxin. Okay. Now, cyclooxygenase also produces thromboxane. Okay. Understood? Now, how does it happen? There is this enzyme which is cyclooxygenase enzyme, which exists as two isoenzymes, COX-1 and COX-2. Now, what were isoenzymes? Go back to your chapter of enzymes. We had discussed isoenzymes, two similar looking enzymes or two different looking enzymes having the same function. Okay, or two similar looking enzymes having different functions. So cyclooxygenase enzyme is, that is COX-1 and COX-2. It exists as two isoenzymes. It is also known as prostaglandin H synthase. Okay, that means the first prostaglandin to be synthesized is prostaglandin H, right? So prostaglandin H synthase. This cyclooxygenase has two activities. One is cyclooxygenation. Excuse me. Second is catalase. Now, go back to the last chapter where we read about peroxisomes. How in the peroxisomes there is the synthesis of very long, or there is the beta oxidation of very long chain fatty acids, right? And what happens on their breakdown? Hydrogen peroxide is produced, which is then broken down into water and oxygen by the catalase enzyme. Similarly, here this catalase enzyme is also present in the cyclooxygenase pathway. Okay. Now what happens is two oxygen molecules will condense to form an endoperoxide. See, peroxide is being formed, isn't it? Which is prostaglandin H. This prostaglandin H by catalase will be converted to PGD, that is prostaglandin D and prostaglandin E, then thromboxane A2 and prostacyclin I2. Then further they will be converted, the reaction will proceed. So what happens from arachidonate? What is happening from arachidonate? You are going to get these molecules. So if you start, this is arachidonate. Where have you got arachidonate from? Arachidonate has been formed either by the action of phospholipase on phospholipids. Phospholipids will be broken down by phospholipase A, or it can be got from the diet. Okay. Now this arachidonate, by the action of cyclooxygenase, cyclooxygenase will act on it. Just a second. Yeah. Okay. Yeah. Okay. Let me just adjust it. All right. So this arachidonate, by the action of cyclooxygenase, is going to produce what? What was the first prostaglandin that was formed? That was PGH, right? Prostaglandin H, isn't it? Which is an endoperoxide. Hi Mudit, you're late. Why are you late? These days you're getting late to the class. Okay, so prostaglandin H is the first one that is produced. Now peroxidase will come in, and peroxidase is going to convert it into the rest of the prostaglandins. What are those? The first one here will be PGD2. Isomerase enzymes will come, and isomerase enzymes are going to convert it into different types of prostaglandins. Okay. Now, what is the prostacyclin that is produced? Prostacyclin synthase enzyme will come in. Prostacyclin synthase enzyme will come, and it is going to produce PGI2, which is the prostacyclin. Got it? Understood? Just a second. Okay. All right. Next. So PGD2 has been formed. Next, what was being formed? Thromboxane. Using which enzyme? Thromboxane synthase. Thromboxane synthase was the enzyme. Using that enzyme, thromboxane A2 will be formed. Okay. And this thromboxane A2 will further convert to thromboxane B2 and the like. Okay. Are you getting it? So this is how things are going. So PGD2, PGE2 will also be formed using another isomerase. So you see what I was talking about here. Two oxygen molecules are starting the reaction. Cyclooxygenase, PGG2, and peroxidase will form this PGH, which is the first prostaglandin to be formed. That is why it is also known as prostaglandin H synthase or PGH synthase. Understood? This is very, very important. Okay. So this was the cyclooxygenase pathway that is responsible for the synthesis of prostaglandins, prostacyclins, and thromboxanes. Okay, understood. Now we are going to see how the three different groups work. Okay, the first group was uh, the first group was linoleic acid. Second group was linolenic acid. Second group was arachidonate. And the third group was linolenic acid. That is, the first group of icosanoids was being produced from linolate, second group from arachidonate, and third group from alpha linolenate. Okay, so we are going to see how these three groups are formed. So linolenic or linoleic acid, you know that it is essential, and alpha linolenate is also essential. So these two we'll only be getting from the diet. Alpha linolenate we are getting from the diet only, and linolenate both of these we are getting only from the diet. Got it? Now what will happen? They will be acted upon. They will first lose 2 hydrogen atoms, then they will gain 2 carbon atoms, and again they will lose 2 hydrogen atoms. So this is what is happening here. First they are losing 2 hydrogen atoms, both of them. Okay, then they will be gaining 2 carbon atoms, both of them. Okay, so we'll write alpha, this linolate will become gamma linolate. After the addition of 2 carbon, it is going to become dihomo gamma linolate. Okay, now here alpha linolenate after losing 2 hydrogen is going to become octa deca tetra inoate. After gaining 2 carbons, it is going to become icosa tetra inoate. Is the name difficult for you to understand? Icosa, as we know, icosa means 20 carbons. So octadeca, what is octadeca? Octa means 8, deca means 10. Octadeca means 18. 18 and then 4 inoate. Okay, so tetra inoate is the same. You gain 2 carbons, so 18 plus 2 is 20. 20 carbons is what? Icosa. So octadeca plus 2 carbons, octadeca is 18 carbons. Octadeca plus 2 carbons will be icosa tetraenoate. Now whatever is going to happen to these two intermediates, that is dihomo gamma linolate and icosa tetraenoate. This icosa tetraenoate is again going to lose 2 hydrogen to form what? Icosa pentanoate. Okay, now this dihomo gamma linolate is going to give rise to the first group of prostaglandins and leukotrienes. The first group. Okay. The cyclooxygenase pathway will be numbered by 1 and the lipoxygenase pathway will be numbered by 2. So cyclooxygenase pathway group 1 prostaglandins, that is, it will be E1, F1 and TX, that is thromboxane A1. Then leukotrienes will be LTA A2, LTC2 and LTD2. Okay, now it will also lose 2 hydrogen To give what? Arachidonate. Now, arachidonate is formed either from phospholipids, that is membrane phospholipids. They will also, by the action of phospholipase, they will give what? Arachidonate. Now, arachidonate is also coming from the diet. Phospholipase A will act on membrane phospholipids to give rise to arachidonate. Arachidonate is also coming from the diet. Arachidonate is also coming by dehydrogenation of dihomo-gamma linoleate. So linoleic acid and alpha linolenic acid, that is, this linoleic acid and alpha linolenic acid are both dietary or nutritionally essential. They are obtained only from the diet. After they are obtained from the diet, they will undergo first they will undergo a dehydrogenation reaction, then they will undergo a carboxylation reaction, then again they will undergo a dehydrogenation reaction. You got it? 2 hydrogen are removed, 2 carbons are added, 2 hydrogens are removed. Okay, understood? So dihomo-gamma linolate is going to provide you with the first group of prostaglandins and leukotrienes. After undergoing dehydrogenation, arachidonate will be formed, which is going to give you the second group of prostaglandins. Okay, now second group of prostaglandins, PGD2, PGE2, PGF2 and thromboxane A2, PGI2 also, prostacyclins, and leukotrienes and lipoxins. Okay, leukotriene A4, B4, C4, D4, E4. Similarly, lipoxin A4, B4, C4, D4, E4. Okay, got it? So this is the group 2. With icosapentanoate, it is going to give rise to the third group of prostaglandins and leukotrienes. Group 3, prostaglandins. Okay, PGD3, E3, F3, sorry, PGD, yeah, and leukotrienes A6, B6, C6. Understood? Got it? So this is how the cycle works. It is very, very important for you to know that group 2 is obtained from arachidonate. Arachidonate is got from membrane phospholipids through phospholipase A and from diet, also by dehydrogenation of dihomo-gamma linoleate. This linoleate is obtained from linoleate that is obtained nutritionally from the diet. This icosapentanoate is obtained from icosatetranoate, which is obtained from alpha linolenate, which in turn is obtained from the diet. So this is how the 3 groups of prostaglandins and leukotrienes are formed. Okay, have you understood? It is very, very essential. Okay, now this when I told you cyclooxygenase, it is inhibited by, cyclooxygenase was inhibited by which drug? Indomethacin, aspirin, ibuprofen. That is, what are these drugs? NSAIDs, non-steroidal anti-inflammatory drugs. What are these drugs? They are not steroids, but what happens is they will inhibit the formation of prostaglandins. That is, their action is analgesic, their action is anti-inflammatory. Okay, so prostaglandins are mediators of inflammation. So whenever they will act, they will inhibit the production of cyclooxygenase. This thromboxane, this is inhibited by imidazole. So thromboxane, which causes platelet aggregation, this is inhibited by imidazole. Now, what are prostacyclins? Prostacyclins are produced by blood vessel walls and these prostacyclins inhibit platelet aggregation. So prostacyclins, that is these are prostacyclins, they inhibit platelet aggregation, whereas thromboxane, they cause platelet aggregation. So they act in opposite directions. I hope everything till now has been clear. This is all about eicosanoids, that is 20 carbon containing fatty acids, very long chain fatty acids. Okay, understood? So please know how do these three groups are formed, and how does arachidonate, that is the cyclooxygenase pathway. This is also very important. Next, we come to acylglycerols or sphingolipids. Okay. Now, what are sphingolipids and what are acylglycerols? First, you should know that. Acyl means something related to fatty acids. Glycerol is glycerol, that is an alcohol. So, fatty acid combining with an alcohol gives what? Fat, isn't it? It gives rise to the simple lipid. A simple lipid, that is fat. This acylglycerol is a simple lipid. Now, triacylglycerol means glycerol containing 3 fatty acids. It is the major lipid found in fat deposits and in food. That is glycerol, which has 3 OH groups. Okay, those 3 OH groups are all saturated by 3 fatty acids. Okay, understood? That is, it is a trihydric alcohol, glycerol. Now, what are sphingolipids? Sphingolipids contain sphingosine. They are a type of phospholipids, that is lipids containing phosphate, along with sphingosine. Now, sphingosine is something that is present in ceramide. Now, what are all these terms? You must have heard of these terms. Now, ceramide is extremely booming these days in the cosmetic industry. Ceramide, you find ceramide rich enhanced creams, you find hyaluronic, like just like hyaluronic acid had been the it word about 5-6 years back, because now hyaluronic acid is also a thing of the past. It has been talked about too much, and now everyone knows about hyaluronic acid. Now the next it word in the cosmetic industry is what? Ceramide. Now I don't know about the boys, but the girls must be knowing about it. I don't think it is a sexist comment to make, because I can very safely say that most of the boys would not be knowing about ceramide, but girls would be knowing about it. They must have heard about it in their daily moisturizers or creams or whatever the advertisements that come. So ceramide, I will be talking about what ceramide exactly is. Okay, so that the next time you get that ad, you watch that ad of a popular cosmetic brand, you know what they're talking about. So ceramide is a type of lipid about which we will be discussing. It is very important, extremely important, not just from the cosmetic point of view, rather from your it is almost the backbone of your nervous tissue. Very, very important. Okay, so sphingolipids, acylglycerols, these are extremely important fats. Okay, acylglycerols are simple lipids. That means triacylglycerols, 3 fatty acids combining with glycerol. So this is what a fat is. Okay. Now, these are amphipathic in nature. You know that. Amphipathic. You remember we had studied about micelles. We had studied about how the liposomes are there. We had studied about how the cell membrane phospholipid bimembrane is there. So this is the hydrophilic head and a hydrophobic tail. Okay, and so understood. So this is what the structure of a micelle is. It is going to grab a grease particle through the hydrophobic ends, and this hydrophilic heads are going to be surrounded by water. So this is what is the structure of a micelle, like detergents, like bile salts. Okay, this is what amphipathic lipids are. What? Amphipathic lipids are those containing both a polar as well as a non-polar end. Okay, so they are lipid component of cell membranes, that is phospholipids. They form phospholipids. They are very, very important part of surfactant, that is dipalmitoyl phosphatidylcholine, which is also known as lecithin. Dipalmitoyl phosphatidylcholine is very, very important. It is the surfactant present inside the lung alveolar tissue. It maintains the alveoli in the expanded state by maintaining its surface tension. Okay, so even after breathing out, the alveoli don't collapse. Why? Because of the surface tension in the alveoli. If you blow a bubble, the bubble stays. How does it stay? Because of the surface tension. Okay, the froth present on top of the coffee that you must be drinking right now to keep awake during my boring lecture. So that froth on top of your coffee, that froth has a lot of bubbles. How do the bubbles stay? They stay as long as there is enough surface tension on them to escape the balance the atmospheric pressure. Okay, but once the surface tension reduces and the atmospheric pressure overcomes, then the bubbles burst. Similarly, there is need for surfactant on the globular alveoli, in the globular alveoli, so that they remain intact and they don't collapse. The walls of the alveoli don't collapse during exhalation. Understood? So this surfactant is very, very important. Now, in premature babies or neonates, what happens is there is not enough surfactant, or not enough production of dipalmitoyl phosphatidylcholine, which is lecithin. So what happens is they cannot breathe properly. Okay, there is distress in the lungs, and what happens is neonatal respiratory distress syndrome. You get the oxygen saturation is not maintained. Okay, there is rapid breathing, there is a ground glass appearance on the x-ray. Okay, and to prevent that, what is required is the mother is given an injection of cortisol, an injection of betamethasone. That betamethasone is a type of steroid which enhances lung maturity, that is production of surfactant. Okay, so this is very, very important application. Okay, so how does the catabolism of triacylglycerol start? Hydrolysis of triacylglycerol initiates their catabolism. Okay, so what happens is lipase is the enzyme. What is lipase? Lipase is a dietary enzyme. You must be hearing of lipase in the intestine, right? The enzyme lipase, intestinal lipase. Okay, lipase will hydrolyze the dietary triacylglycerol to its constituent fatty acids and glycerol. That means triacylglycerol that is present in the diet is broken down by intestinal lipase into fatty acids and glycerol. This occurs in the adipose tissue, mainly in the adipose tissue, and there is release of free fatty acids in the plasma where they can combine with albumin. You remember in the last chapter we discussed how fatty acids cannot travel like that in the blood. Why? Because most of the long chain fatty acids are non-polar and they cannot mix with blood, which is a polar solvent. So long chain fatty acids require albumin. So in spite of their name being free fatty acids, they are free from glycerol, but they are not totally free. Rather, they are bound to albumin in the plasma. Okay, now these albumin bound free fatty acids are taken up by the liver, heart, kidney, muscle, lung, testes, adipose tissue. There again they can be oxidized for energy, that is beta oxidation, or they can be re-esterified into triacylglycerol. So these free fatty acids can either undergo beta oxidation whenever high energy will be required or enough glucose is not there. So these free fatty acids will be oxidized through beta oxidation, Or if there is no need for energy at that time, then they will be re-esterified into the storage form through triacyl glycerol. Okay, now what is the fate of this glycerol? Glycerol is utilized wherever the tissue contains glycerol kinase. So whichever tissue contains high quantities of this enzyme, glycerol kinase, there glycerol will be utilized. So liver, kidney, intestine, brown adipose tissue and lactating mammary glands can easily utilize glycerol because they have high quantities of the enzyme glycerol kinase. Understood? Now, how are triacyl glycerols formed? Triacyl glycerols and phosphoglycerols also. Phosphoglycerols means triacyl glycerols containing a phosphate group. Okay, so they are complex lipids. They're a type of complex lipids. Now, triacyl glycerols and phosphoglycerols are produced by the acylation of triose phosphates. Okay, now triose phosphate means what? Triose is saccharides containing 3 carbons. So you see how here the glucose and the fatty acid metabolism are intersecting. So triose was what? Like glucose is a hexose. Triose we studied in the first chapter of Introduction of Carbohydrates, we studied how there are only 2 trioses. What are these two trioses? Glyceraldehyde, which is an aldotriose, and dihydroxy acetone, which is a ketotriose. Ketotriose and aldotriose. So there are only 2 3 carbon containing saccharides, that is, one is the aldehyde form, that is glyceraldehyde, and the other is the ketone form, that is dihydroxy acetone. So triose phosphate means the phosphate form of these. Glyceraldehyde 3-phosphate, dihydroxy acetone 3-phosphate. So these phosphate molecules, that is glyceraldehyde 3-phosphate and dihydroxyacetone phosphate, are going to give rise to triacyl glycerols and phosphoglycerols. Okay, so triacyl glycerol, phosphatidylcholine, phosphatidylethanolamine, phosphatidylinosytol, cardiolipin, which is an important constituent of mitochondrial membranes, are all formed from glycerol 3-phosphate. Glyceraldehyde will get reduced to glycerol, okay, which will form glycerol 3-phosphate. So triacyl glycerols and phosphoglycerols of phosphatidylcholine, phosphatidylethanolamine, phosphatidylinosytol, cardiolipin, they are all going to be formed from glycerol 3-phosphate, and DHAP will form phosphoglycerols with an ether link, not an ester link. Now, which were these? You go back to the first chapter of lipids, we discussed plasmalogens, remember, and platelet activating factor. Okay, so glycerol 3-phosphate is going to give rise to triacyl glycerols, phosphatidylcholine, phosphatidylethanolamine, phosphatidylinosytol, and cardiolipin. And DHAP is going to give rise to ether containing phospholipids, which are ether bond containing phospholipids, not ester bond. Okay, ether bond is what? CO, and ester bond is what? COO. Understood? So ether bond containing phospholipids will be produced by phosphoglycerols will be produced by DHAP, and ester wale will be produced by glycerol. Understood? Okay, so there are 2 branch points for these, that is one at phosphatidated, one at diacylglycerol. This we are going to read. Okay, so that is what I was telling you. Glycerol 3-phosphate and DHAP will link lipid metabolism with glucose metabolism very conveniently, right? Because they are both intermediates in glycolysis, isn't it? Glyceraldehyde 3-phosphate will get reduced to glycerol 3-phosphate. So you can for convenience, call it an intermediate of glycolysis. Is everything clear now? Till now? Okay, so can we start with the cycle? We will start with the cycle of how it is produced. Okay, now just like beta oxidation of fatty acids, where the fatty acids had to be activated before being oxidized, they had to be activated. Now glycerol and fatty acids here also, they need to be activated before being incorporated into acyl glycerols and phospholipids. Okay, so how does it happen? Glycerol kinase. Glycerol kinase is an enzyme. Kinase has come here. What is the meaning of kinase? Something related to phosphate will be happening. So phosphate will either come in or phosphate can either go out. If phosphate is going to be added, then ATP is going to be used. If phosphate is going to be removed, then ATP is going to be produced. So glycerol is getting converted to glycerol 3-phosphate. That means phosphate is getting added. That means ATP will be required. Okay, so glycerol kinase will activate glycerol into glycerol 3-phosphate using ATP. Okay, now this glycerol 3-phosphate will be acted upon by an enzyme, glycerol 3-phosphate acyl transferase. What will that do? An acyl group will be added onto glycerol. Okay, where is this acyl group coming from? Acyl CoA is coming. This high energy acyl CoA is coming, and it is getting added to glycerol 3-phosphate to produce what? It is going to produce 1-acyl glycerol 3-phosphate. At the first carbon, acyl has been added and CoA will be released. Okay, now again one more acyl CoA will come and get added to it. Okay, then what will be formed? 1,2-diacyl glycerol phosphate. So on the so this is glycerol. Okay, on this carbon, 1 phosphate has been added. In the first step, what will happen? Acyl group will be added on the first carbon. In the second step, another acyl group will be added on the second carbon. And what will be produced? 1,2-diacyl glycerol phosphate. And what is the common name for that? Common name is phosphatidate. Phosphatidate. Very, very, very important reaction. Okay, phosphatidate. Understood this? Now, let us quickly draw it. So, glycerol is going to come in. Okay. It will be activated by glycerol kinase using ATP to produce glycerol 3-phosphate. Now this glycerol 3-phosphate will then be acted upon by glycerol 3-phosphate acyl transferase. This acyl transferase will transfer the acyl group from acyl CoA onto the first carbon of glycerol. So it will become 1-acyl glycerol 3-phosphate. Got it? Now this is also known as lysophosphatidate. Now again an acylation reaction will occur. Okay, what is the enzyme here? The enzyme will be very easily, the substrate is 1-acyl glycerol 3-phosphate acyl transferase. Okay. This acyl group will be transferred from acyl CoA onto the second carbon of glycerol. So it will become 1,2-diacyl glycerol phosphate. Okay. What is its common name? Phosphatidate. This is the common name. Okay, very, very important. This is the precursor for all triacylglycerols, all phospholipids here that we were talking about, apart from the ether ones. And it is the precursor for um, phosphatidylcholine, phosphatidylinosytol, phosphatidylethanolamine, phosphatidylserine, triacylglycerols. All right, got it? So from here, what will happen is, now if you start, this is phosphatidate. Okay. Now what will happen is, it is going to be converted to 1,2-diacyl glycerol. Okay. What is happening? Phosphate group is getting removed using water. So what is its, what will the enzyme be called? Phosphatidate phosphohydratase or hydrolase. So the phosphate group in 1,2-diacyl glycerol phosphate, the phosphate group is getting removed along with using water, and what is being formed? It is 1,2-diacyl glycerol is being formed. Okay, this is very, very important. 1,2-diacyl glycerol. Okay, this 1,2-diacyl glycerol, this will change to triacyl glycerol using another molecule of acyl CoA. Okay, so triacyl हो गया, 3 acyl glycerols are added. Very, very easy, isn't it? Diacyl, what will be the enzyme? Diacyl glycerol acyl transferase. Or another way where it can go in the phospholipid branch is choline. Choline will become phosphocholine using ATP and a kinase, that is choline kinase. Phosphate is added on the choline. So ATP is used. And what is the enzyme for adding phosphate? Kinase. What is the substrate? Choline. So choline kinase will produce phosphocholine. Now this phosphocholine will then produce CDP choline, that is, it is combining with CTP, just like UDP or uridyl transferase or uridyl phosphate was combining with glucose, galactose, glycogen. Similarly, CDP is combining with choline here using CTP and 2 phosphate molecules. And what will happen is, this CDP choline, this will then get converted to phosphatidylcholine after its addition on 1,2-diacyl glycerol. So 1,2-diacyl glycerol will add to CDP choline to produce phosphatidylcholine. Now this phosphatidylcholine will lose a methyl group, okay, to produce phosphatidylethanolamine. This phosphatidylethanolamine can also change to phosphatidylserine. How? By losing a carbon dioxide molecule. Phosphatidylserine. So you see, diacylglycerol has changed to phosphatidylcholine, has changed to phosphatidylethanolamine, has changed to phosphatidylserine, and triacylglycerol. Okay, now this 1,2-diacylglycerol, before this, what was it? Phosphatidate. This phosphatidate can branch to give phosphatidyl inositol. How? By the addition of an inositol group and using CMP. So this inositol will combine with CMP molecule to form a phosphatidyl inositol. This phosphatidyl inositol can become phosphatidyl 4-phosphate inositol, which will then be again phosphorylated to form phosphatidyl 5-phosphate inositol. So is everything clear to you right now? We will again revise. Glycerol will be activated by glycerol kinase to produce glycerol 3-phosphate. Okay. Now glycerol 3-phosphate will be acted upon by acyl transferase, glycerol 3-phosphate acyl transferase. One acyl group will be added on glycerol 3-phosphate on the first carbon. So one acyl glycerol 3-phosphate, which is also known as lysophosphatidate. Now again another acyl group has to be added. Now the glycerol group, the third carbon has phosphate. The first carbon has one acyl group. So only the second carbon is left. So 1,2-diacyl glycerol phosphate is formed. This is a hero molecule known as phosphatidate. So one branch point is from here to produce inositol, because it just needs to add inositol on this because it already has a phosphate molecule. Otherwise, another side is this phosphatidate will lose a phosphate and it will become 1,2-diacylglycerol. This 1,2-diacylglycerol will again be phosphorylated and choline will be added on it to produce phosphatidylcholine, and it can lose a methyl group to produce ethanolamine, where carbon dioxide will be removed and serine will be added to produce phosphatidylserine. Okay, understood. And another acylation of diacylglycerol will be done to produce triacylglycerol, because here the third carbon which contained phosphate is now free because phosphate has been removed. Understood? So this is how these phospholipids are formed. Okay. Now DHAP, which was also coming from glycolysis, DHAP can fully interconvert into glycerol 3-phosphate using glycerol 3-phosphate dehydrogenase enzyme. And what will happen? NADH2 will be used. And these are coming from where? Glycolysis. Now DHAP, where will this DHAP be used? It will be used in the synthesis of plasmalogens and platelet activating factor. Okay, understood till now? What are plasmalogens and platelet activating factor? They are ether bond containing phospholipids. Okay, now I hope till now everything has been clear to all of you. Okay, because now after this we will be starting with sphingolipids. Okay, now fatty acids activated to form acyl CoA by acyl CoA synthetase. Acyl CoA combines with glycerol 3-phosphate catalyzed by glycerol 3-phosphate acyl transferase and 1-acyl glycerol 3-phosphate acyl transferase, forming 1,2-diacylglycerol phosphate. We know that. So glycerol is combining with fatty acids. See, this is what we are saying. Trihydric alcohols means glycerol can combine with 3 fatty acids. So it is combining with 1 fatty acid, forming 1-acylglycerol, combining with 2 fatty acids, forming 2,1,2-diacylglycerol, combining with 3 fatty acids to form triacylglycerol. These acyl-CoA are nothing but activated fatty acids. Understood? Right, okay, got it. And what was the enzyme to activate fatty acids? It was acyl-CoA synthetase. Synthetase means required ATP. ATP was used. Okay, understood? Now, triacylglycerol, how are triacylglycerols formed? We know this. Phosphatidate will be converted to by phosphatidate phosphohydrolase by removing phosphate using water to produce 1,2-diacylglycerol. This 1,2-diacylglycerol converted to triacylglycerol by diacylglycerol acyl transferase, and this DGAT enzyme is the rate limiting step of this whole reaction. Okay, diacylglycerol to triacylglycerol. Okay, understood? Next, we come to sphingolipids. What are sphingolipids? They are also complex lipids formed from ceramide. Now, what is the structure of ceramide? How is ceramide formed? This we are going to read. Ceramide is synthesized in the endoplasmic reticulum from which amino acid? Serine. Here also we read about phosphatidylserine. So serine is very important here. Serine formed a type of phospholipid that was phosphatidylserine, and serine is forming another type of phospholipid which is serine is forming another type of complex lipid which is ceramide. Okay, now ceramide is a signaling molecule used as second messenger in apoptosis, in cell differentiation, in cellular aging, cell cycle, senescence. It is very, very important, plays a role in that. Now, sphingomyelins are phospholipids formed when ceramide reacts with phosphatidylcholine to form sphingomyelin and diacylglycerol. So, sphingomyelins will be produced when phospholipid, when will they be produced? When phospholipid will combine with ceramide, sorry, phosphatidylcholine will combine with ceramide. So this is what ceramide is coming in here. Okay, ceramide is a part of sphingomyelin also, to form sphingomyelin plus diacylglycerol. Understood? Phosphatidylcholine and ceramide will combine to form sphingomyelin, which is a type of sphingolipid, and diacylglycerol. Okay, phosphatidylcholine, where have we heard of phosphatidylcholine? Here. It was formed from 1,2-diacylglycerol, where phosphocholine was combining with 1,2-diacylglycerol to form phosphatidylcholine. So whenever you hear about phosphatidylserine, you should be reminded of this. Whenever you hear about phosphatidylcholine, you should be reminded of this page. Okay, understood? Now, what are glycosphingolipids? Glyco, as the name suggests, glyco means these will contain some type of sugar. Now, sphingolipids we know are made of ceramide. Glycosphingolipids are made when ceramide will combine with one or more sugar residues, like galactoceramide. What is galactoceramide? It will show that ceramide plus galactose is there. So it is present in the myelin sheath. What is glucosyl ceramide? Ceramide plus glucose is there. It is present in extraneural tissues. Okay. So these are what? Glycosphingolipids. Their synthesis also we'll read. Okay. So how is ceramide formed? Palmitoyl-CoA. Now what is palmitoyl-CoA? Activated form of palmitic acid. Palmitoyl-CoA will combine with this amino acid serine, okay, using pyridoxal phosphate and manganese as the cofactors to produce what? 3-ketosphingane. Sphingane. Okay, what is the enzyme? Serine palmitoyl transferase. Now, serine and palmitoyl will be combined. So, 3-ketosphingane will be formed. Okay. Now, reductase enzyme will come in, 3-ketosphingane reductase. It is going to reduce it by using hydrogen from this NADPH donor. Then hydrogen will be added. So what will become? What will it become? Dihydrosphingosine. Dihydrosphingosine. Next, acetyl-CoA will be added. So acyl transferase. What will it become? Dihydroceramide. Sphingosine on addition of an activated fatty acid becomes ceramide. Now, dihydroceramide by the action of dihydroceramide saturase will become ceramide. This ceramide, do you see how it is being formed from palmitoyl-CoA and serine? This ceramide will go and attach to phosphatidylcholine to produce a sphingolipid. Understood? So these ceramide, they are very important signaling molecules for cell aging, cellular differentiation, that is differentiation of the cell into different specialized types. Then apoptosis, that is programmed cell death. Each cell has a program of its own. Each cell is generated, it divides, it specializes, and then it dies. So everything is programmed in the genetic machinery. So the normal programmed cell death of apoptosis, that is also that there are a lot of signaling molecules for that. One of the signaling molecules for that is ceramide. Can you see? Can you imagine this ceramide, which is a product of cosmetics? It has such a varied application, isn't it? Now, what happens here is, we were talking about glycosphingolipids, right? So this ceramide is incorporated, ceramide incorporates sugar residues like UDP is the carrier molecule. This UDP glucose will come in and it will transfer its glucose to ceramide, which will become glucosyl ceramide. Now, this glucosyl ceramide will get another galactose molecule using UDP galactose. It is going to become ceramide glucose galactose. The chain is lengthening. Next, what will come? Using CMP molecule, okay? Using CMP molecule. Now, another molecule is getting added, that is N-acetyl neuraminic acid. Neuraminic acid is getting added onto this. What will then be formed? Ceramide glucose galactose neuraminic acid. Now again N-acetyl galactosamine is being added using UDP. Again the chain is lengthening. Now one more galactose is being added, and similarly it will be, the reaction will continue, the chain will continue. So these higher gangliosides or glycosphingolipids will be formed, and they are used in the nervous tissue, building blocks of nervous tissue. Myelin, extraneural material. So these are formed using these glycosphingolipids. Extremely important. Very, very, very important. Now their production is also under genetic control. Their breakdown is also under genetic control using a lot of enzymes. Whenever these glycosphingolipids start accumulating in the body, then there can be a lot of sphingolipidosis, that is diseases associated with the accumulation of sphingolipids. And why will that occur? When their production is normal, their production is not hampered, but their breakdown, their normal breakdown is hampered due to deficiency of one or more enzymes. So they will start accumulating. They cannot be broken down. They are being produced at their normal pace, but they cannot be broken down because of the deficiency of one or more enzymes. Therefore, sphingolipidosis are those group of diseases where there is accumulation of sphingolipids, lipid storage diseases. Okay, like Tay-Sachs disease, you must have heard of it. It is due to the accumulation of hexosaminidase A and S. Most of these diseases, especially the glycosphingolipidosis, they are going to be accumulated in the nervous tissue and cause mental retardation. Others, they will also affect the skin, the muscles, kidneys. Okay, so those are the areas where they can be affected. Tay-Sachs disease affects the eye also, the retina of the eye. Okay, all right. Niemann-Pick's disease, Tay-Sachs disease can cause Niemann-Pick's disease. It can also cause affect the eye. It is due to the absence of sphingomyelinase. Fabry's disease, due to the absence of alpha galactosidase. That is, galactosidase is not getting broken down. Metachromatic leukodystrophy is due to the accumulation of aryl sulfatase A. Krabbe's disease is due to the accumulation of beta galactoside, and Gaucher disease is due to the accumulation of beta glucosidase. Okay, understood? So alpha galactosidase, Fabry's, beta galactosidase, Krabbe's. Okay, alpha A comes first, F comes first, F comes before K. So Fabry's and Krabbe's are galactosidases. Fabry's is alpha, Krabbe's is beta. A comes before B, F comes before K. Therefore, Fabry's is alpha galactosidase, Krabbe's is beta galactosidase. Gaucher is beta glucosidase. G for Gaucher, G for glucosidase. Got it? Understood? These are very, very important sphingolipidoses. You should be knowing about them in detail. Okay. Also, we read about how the deficiency of surfactant can cause respiratory distress syndrome. What was the surfactant that I was talking about? Surfactant was lecithin. Okay, lecithin. All right. So lecithin is what? Phosphatidylcholine. Okay, phosphatidylcholine is lecithin. Okay, understood? Phosphatidylcholine is also broken down into glycerol 3 phosphate. Why? Because it was produced from glycerol 3 phosphate. Glycerol 3 phosphate was producing this phosphatidylcholine, which is lecithin. Similarly, phosphatidylcholine, when it will be broken down, it will be broken down into glycerol 3 phosphate. Okay, understood? So I guess this will be it for today's session. I hope you have understood this. Extremely important is this topic. The synthesis of triacylglycerols, the synthesis of phospholipids. Then very, very important is this, the synthesis of ceramide. How ceramide is incorporated into the tissues. How ceramide is incorporated into sphingolipids using phosphatidylcholine. How ceramide is incorporated into glycosphingolipids using UDP glucose, UDP galactose, neuraminic acid, and acetyl galactosamine. And synthesis of ceramide using palmitoyl-CoA and serine to produce sphinganine, to produce dihydrosphingosine, to produce dihydroceramide, which then through saturase will produce ceramide. Ceramide is an important signaling molecule for the cell. Okay, I hope all these topics are extremely clear to everyone. Sphingolipidoses. What are sphingolipidoses? The diseases that occur due to accumulation of sphingolipids. Okay, what are sphingolipids? Sphingolipids are produced, sphingolipids are phospholipids containing ceramide. Ceramide is what? Ceramide is formed from palmitoyl-CoA along with serine. Palmitoyl-CoA and serine combining to give sphinganine, which will by using the enzyme palmitoyl-CoA serine transferase, then serine palmitoyl transferase, then reductase will produce sphinganine sphingosine, then sphingosine by acyl transferase will produce ceramide, and ceramide dihydroceramide, which by the action of saturase will produce ceramide. So just go back and draw these. just even once if you draw, everything is going to be crystal clear to all of you. Okay, now very, very important is this, how arachidonate the cyclooxygenase pathway and these three groups of prostaglandins, how they are formed using dihomo gamma linolate, then icosa pentanoate, and arachidonate. Okay, arachidonate is arising from the membrane phospholipids using phospholipase A. It is coming from the diet, and it is also coming from dehydrogenation of dihomo gamma linolate. I hope everything is clear from this topic, icosanoids and all. And icosanoids play a role in inflammation and allergic path, mediation of allergy. The next topic is going to be lipid storage, and after that, cholesterol. And with that, we will be finishing with this very important, magnanimous unit of lipids. Can you imagine this lipid chapter, which usually was so we used to be so apprehensive about it, and we have finished more than 60-75% of the chapter. So congratulate yourself, pat yourself on the back. And yes, so be ready for the next two sessions where we'll be breaking down complex topics like this. We will be making cycles and diagrams and reactions on the go, discussing clinical aspects on the go. And yeah, okay. So one important question for all of you is, what is the rate limiting step in triacyl glycerol synthesis? Do let me know in the comment section whenever you are attending this session, or you, even if you're watching it the recorded session, not the live session. Do let me know in the comment section, what is the rate limiting step in the synthesis of triacyl glycerols? Okay. So after finishing this session, we are going to have a short, no, after finishing this unit of lipids, we are going to have a short MCQ discussion, because this is very, very important, the chapter of lipids. I hope everything is getting accumulated and consolidated in your mind right from the beginning. How enzymes are working, how enzymes are being named, how different classes of enzymes are acting, like oxidoreductases, kinases, when ATP is used, when ATP is not used, like in synthase, synthetase. So these small tips and tricks, I hope you're keeping in mind while reading the subsequent chapters. And okay, so we'll be meeting a couple of days later with another session. Okay, guys, bye bye. Take care. Have a great evening. Enjoy. Have your cup of coffee, tea, or a chilled glass of juice, and we'll meet again. Bye bye. Take care.